test. You do need to contact your local health department beforehand to arrange for a test. While testing numbers continue to frustrate Georgians and state leaders alike, I am proud to talk about the progress that we have made to expand surge capacity. Over the weekend, the state executed a contract to build an alternative care facility at the Georgia World Congress Center. Yesterday, the Georgia National Guard, GEMA, the Department of Community Health, Department of Public Health, and contractors began preparing the site for potential coronavirus patient surge. Using the 200 non-ICU medical pods, similar to large cubicles with patient rooms, we will be able to house Georgians with mild to moderate illness. And, if needed, we can quickly expand capacity to 400 non-ICU beds. Our team will utilize contract medical staffing for the state's projected peak date, currently set for April 26, 2020, according to the IHME model. This project will leverage existing support through nearby Grady Memorial Hospital, with initial operating capacity available in roughly 1 week. We are grateful for our partnership with Grady under the leadership of John Hopper. This project will ensure flexibility and address needs as they arise. But this project, as you know, is just one of many that is underway to prepare for surge capacity in our state. Recently, we've secured commitments for many Georgia hospitals to convert hundreds of rooms into critical care space. Just a few days ago, Piedmont Healthcare announced an early opening of the Marcus Tower to bring 132 beds online, including 64 ICU beds for coronavirus patients. This expanded capacity at healthcare facilities across Georgia, and now in the aftermath of the severe storms as we saw today, this is a good example of why you need a facility like the one we are standing up at the Georgia World Congress Center. In coordination with the Georgia Hospital Association, we have worked to gather the most up-to-date information on bed capacity so we can continue to make informed decisions. As of today, we have 2,617 emergency room beds, 929 critical care beds, and nearly 6,000 general inpatient beds available statewide. By the end of this week, we hope to provide this bed capacity update daily to the public. For over a month, we've talked about our aging population, our most vulnerable in the battle against COVID-19. We have issued guidance and orders to protect these men and women, and we've taken measured steps to shield them from harm. Right now, there are at least 80 long-term care facilities, including nursing homes, assisted living facilities, personal care homes, hospice, and similar community living facilities with coronavirus cases. We are working to verify new information on additional facilities as we speak. To mitigate the spread of coronavirus in these facilities, I have charged General Cardin with deploying teams to those facilities to sanitize and train staff on infection control measures to stop further spread. Utilizing 60 infection control teams, the Guard has now cleaned 229 facilities. Right now, the Guard has 19 medical support teams, with most comprised of physicians, nurses, and medics working in hospitals to assist with the coronavirus triage and treatment. We have 60 service members working hospital entry at 21 hospitals and 27 service members deployed at state isolation sites. We also have service members stationed at 10 food distribution sites to assist with the delivery of goods. The Georgia National Guard is literally working day and night to keep Georgians safe. As I've mentioned previously, the state purchased 4 temporary medical units to expand bed capacity and strategically deploy them based on need. In Rome, we will have 1 unit operational by April the 21st. In Albany, we will have a 2nd unit operational on April the 28th. We will have 1 unit in Gainesville and 1 in Macon, both set to become operational on May the 5th. To quickly increase staffing in critical health care locations affected by the virus, the state has partnered with Jackson Healthcare, which has a portfolio of staffing, search, and technology companies to assist health systems, hospitals, and facilities with workforce needs. We're working through Jackson Healthcare's subsidiary, Healthcare Workforce Logistics, to bring roughly 570 additional healthcare professionals to key systems across our state. We'll be issuing a press release later with more information, and the state is creating specific guidance on how healthcare facilities can request this assistance. This battle against COVID-19, we have seen businesses, organizations, institutions, and Georgians from literally every corner of our state go and above and beyond to lend a hand. One great example is our world-class university system. Recently, Augusta University, the state's only public academic medical center, launched a web-based app that provides telemedicine screening of patients. With an app available on Apple and Android smartphones, this tool allows healthcare providers to interact with patients without risk of exposure. It's called the AU Health Express Care. If the result is a positive screening, further instructions will be provided on where to go for testing. Having tested this program in the Augusta area to 7,500 individuals, Augusta University is ready to offer this tool statewide. To access the app, go to augustahealth.org/COVID-19. augustahealth.org/COVID-19. For those without access to the internet or video capabilities on their smartphone or computer, you can call Augusta University's COVID-19 hotline at 706-721-1852. Again, that COVID hotline number for Augusta University, 706-712-1852. By leveraging technology and embracing innovation, we can ease the burden on medical facilities and provide patients access to the care that they need. To facilitate emergency response efforts and provide assistance to the communities in need, as you know, I have issued a multitude of executive orders. Earlier today, I signed an order suspending enforcement of Georgia's anti-mask statute so people can follow the guidance of public health officials without fear of prosecution. I want to especially thank Atlanta Mayor Keisha Lance Bottoms for raising awareness about this issue in our state. There are several other people and organizations that I'd like to recognize for their efforts behind the scenes. Once again, I'd like to thank Kevin Brown, CEO of Piedmont Healthcare, and his team, along with many, many other great healthcare professionals across our state, for literally working night and day on smart ways to increase our surge capacity in our state and keep our Georgians safe and happy, as well as healthy. They have really done a tremendous job of helping us with that, and I'm very grateful. I also want to thank many members of the business community, too many to name, that have stepped up to answer the call to action in recent weeks. But a few, like Delta Airlines, which is providing free flights for out-of-state medical volunteers who are willing to travel and join the frontline fight against the virus. CVS Health, which we talked about last week, which helped us increase our testing capacity by 1,000 tests per day at Georgia Tech. Like Home Depot, which is prioritizing shipments of PPE to healthcare workers, and many other businesses who have completely overhauled their operations to provide resources and those supplies we need to frontline workers. I also want to thank our state and local law enforcement for their hard work. Many of these men and women, as you know, spent their weekend patrolling our beaches and parks, ensuring that Georgians were following the guidance. Many of these individuals were up all night last night following the storm and were on the ground working first thing this morning and still are today. I specifically want to thank Colonel Gary Val and the Department of Public Safety, as well as Commissioner Mark Williams and the Department of Natural Resources for working really hard this weekend in our parks and on our beaches, in many, many other places. I also want to thank Director Bryson and all the folks at GEMA that have not only been involved in the fight against the virus, but also working with us the last 24 to 48 hours to prepare and now to respond to these deadly storms, as well as Director Chuck Williams and the Forestry Commission, who has chainsaw strike teams and other men and women and equipment all throughout our state helping with the cleanup today, as well as Commissioner McMurray from DOT, many of his folks with saws, trucks, and equipment, and countless hard-working Georgia volunteers that are showing up to these damaged areas with a four-wheeler or a tractor and a chainsaw to help their fellow Georgians. I am grateful. Your state is grateful. And finally, on the heels of the Easter weekend, I want to sincerely thank our faith community in our state. This past weekend, for the first time in perhaps their history, many had to find new ways to worship during the most sacred time of the year to ensure the health and safety of their congregations and their fellow Georgians through online, drive-in, or call-in services. It was a great reminder that even though we must be apart right now, we can still come together and worship. And I want to thank those faith leaders for their participation this weekend. I know that was not easy. It was not easy for our family or many families across Georgia, but we are grateful for your commitment to your congregation, to your parishioners and our citizens, and to your faith. I'll now ask General Carden to come up and provide an update about what the National Guard's been doing, and then we'll be glad to take your questions. General.
Thank you, Governor. Good afternoon. On behalf of the soldiers, airmen, and members of the State Defense Force, I want to thank the Governor for the opportunity to serve, and I want to thank my teammates, Director Bryson and Dr. Toomey, as we continue to get after COVID-19. The Governor mentioned all of our mission profiles, and whether it's the 1,000 soldiers and airmen that are out working on infection control teams, or our medical support teams working in hospitals, or our soldiers, airmen, and members of the State Defense Force working in food banks to make sure Georgians get fed, or the ones that today started a mission here in Fulton County to make sure school children get their school lunches. We're eternally grateful to be able to serve our citizens, our governor, and our teammates at this critical time. As you know, the governor gave us a mission in DOD with the help of Director Bryson and Dr. Toomey, as well as the Department of Community Health, Commissioner Frank Berry, with respect to comparing hospital capacity to anticipated requirements. We're well into that. As the governor mentioned, at the World Congress Center, we have a team working that right now alongside the contractors that's been hired to put that facility in place. And so I just want you all to know that we're looking at the models, and those models are a decent guide with respect to balancing capacity and requirements, but it's not a foolproof guide. At the end of the day, we're in really good shape, not by hundreds, but by more than 1,000 with respect to beds, both ICU and general beds, when it comes to the median range that the models are calling for. But when you look at the upper bound range of the current models, we're not in such great shape. And so in looking at that and comparing it with the governor's mission statement that he gave us as a team, and that is to make sure that no Georgian suffers for the lack of being able to get to the appropriate level of medical care. I can assure you that this joint interagency public-private partnership will not fail our governor and will not fail our state. We believe that this facility at the Georgia World Congress Center will serve as a very important relief valve for the entire state should we run north of our surge capacity. And so that's what we're doing at the World Congress Center. We're going to work tirelessly to make sure that facility is in a position to serve Georgians. I frankly prayed that we don't need it, but I will tell you that it's going to be in place and it's going to be able to support you. It's going to be able to support your family at your time of need. Thank you all very much.
Okay, you just heard Georgia Governor Kemp giving a second state of emergency declaration, a second one after COVID. Now we've got the tornado state of emergency declaration. Just briefly, a couple quick points from that in case you're just joining us. The governor said there's 7 dead in Georgia from the storms, dozens injured, and dozens of homes destroyed or damaged. Then he went on to the virus and the outbreak. Latest numbers as of noon, 13,315 Georgians with a case of the virus, 464 deaths. They've got more than 54,000 tests done. They're still behind, but they're trying. Now let's get to the main point. The peak date, April 26, said the governor. That's where they're projecting, according to the models, the peak date of the outbreak in Georgia. And to deal with that issue, the governor and the National Guard, they're saying that they have more than 1,000 beds above and beyond the 10,000 beds they have ready to go in case they need it as the surge happens. And then they'll be moving capacity around the state to the hot spots. Finally, the governor has suspended the anti-mask law, an old archaic law to prevent robbers from having masks out in public when we need masks to stay safe. That law has been suspended. We now return you to regular programming.